What's up, everyone? Today I want to tell you really quick about rotator cuff tearing that you may have. This is one of those things that I get a lot of questions about. One of my TikTok videos that I put out on supraspinatus dysfunction, one of the rotator cuff muscles, it really has gotten a lot of questions. I get probably asked about that one the most over all the other videos that I put out. And so people ask, do you do strengthening exercises or stretches, or do you need manual therapy, like hands-on techniques kind of stuff, and do you need modalities like ultrasound, or do you need to have surgery? Kind of what's the what do you need to do there? A lot of people don't know what the first step is, and then kind of where to go from there. How to treat it. And so and this is my opinion, of course, and based off of just my experience and kind of how I do things. With rotator cuff injuries, if it is determined that you do have a tear, let's say a partial tear or a full tear, so it's called partial thickness tear or full thickness tear, and a full thickness tear will be where that tissue is completely torn in two, the tendon's completely torn in two, and a lot of times you have retraction where the tendon kind of pulls apart away from each other, either the two pieces of tendon that have been cut or torn, or where it pulls away from the bone, from its insertion on the bone. And if that happens and you have a full thickness tear, you have a couple of options there. We're kind of going to go worst case scenario first, then work our way back to the easiest. With that, obviously, if you're a candidate for surgery, you could have a surgical repair. You could strengthen the muscles that are still intact, the other three remaining rotator cuff muscles, provided that it's just the one that's torn. A lot of times you may have a couple of the rotator cuff tendons torn. You may have a bicep tendon that's torn, or maybe the labrum, kind of the cartilaginous rim inside there that helps to hold the ball in the socket, so to speak. That may be torn. So it's not always just like one tendon that's torn, or you just have just one area that's having this dysfunction. A lot of times it could be a couple of different areas. But if it is just the one area, you can try to strengthen the remaining rotator cuff muscles, build as much strength and stability as you can, and just with progressive exercises and all that, and try to see if that helps to regain as much mobility as you can get back. Especially if you're in a situation where you can't take off work, you don't have 3-4 months to dedicate to rehab and those kind of things, or you can't miss work for that long, which a lot of people can. So trying to kind of limp along with it, so to speak, as much as you can. Trying to do some of those exercises, and maybe later on down the road you can see about having the surgery performed. But then if you have like a partial thickness tear where it's just partially torn either across or like down through, those they do a much better, obviously, because you don't have that complete severance of the tissue, and so we still have something connected there. And so if we can do progressive loading, progressive strengthening exercises with that, then we can try to improve the strength of that tissue itself, along with strengthening all the other muscles in the surrounding area. And those do really well. A lot of times you won't have to have surgery for those. In fact, if you look at a lot of research, it supports that therapy techniques and exercises, both with therapy and then following through at home, and maybe modifying some of your activities, some of the stuff that you're doing, kind of taking a little bit of pressure off. It can have a really good result with that. And so I've had, again, over the last 18 years, I've had a lot of patients that come in with partial rotator cuff tears, and maybe the labrum was involved, maybe bicep tendon was a little involved, and then they end up doing really well and not having to have surgery. Now, that's not to say that it's not painful, especially initially when you start doing some of those exercises and things. It's painful, that or can be painful, that you're kind of going through. And some people don't have very much pain at all with it. It just depends really on kind of what all's going on and what your pain tolerance is. One of the things too is I'm not a fan of just passive care with that. I mean, we use ultrasound and e-stim and lasering and all these other things, which are all great, massage and manual therapy stuff. I mean, that's all great, and that all helps and all has benefit and has its place in a lot of aspects of orthopedic therapy. But those things are just kind of used as tools to kind of open up the window for movements, exercises, and in functional task performance, where you're going through some of the different movements, not just rote repetition exercises. So I'm a fan of just kind of a little bit of everything, and I think in conjunction, a lot of those things together will work. I mean, sure, you're going to have some improvements of blood flow in the area and we want to increase blood flow because, you know, we're trying to support tissue healing and all that, absolutely. And if the person's pain becomes better and they can tolerate more exercises or activities or things, then obviously you're going to be able to do more with them. So I'm okay with using it for those purposes. But just going in, you know, somewhere and then just, you know, popping or snapping a shoulder or just doing massage only, or, you know, sticking you with a whole host of these pincushion needles and putting all over you, those are not cure-alls. And again, if you look at the research on that, it does not support those things alone are going to heal or repair you know, tendon pathology. And again, not saying that there's not research that supports it. It does help with maybe some pain, or maybe it help with mobility, things like that a little bit. But again, at the end of the day, you're looking for the best recovery you can get. So you want more of an active approach to the rehab on that. So, and a lot of people ask, where do I go to find these? What kind of exercises should I do? Should I go to therapy? Should I go to the doctor? Well, of course, you know, the disclaimer is you always want to be checked out by your primary care or specialist physician or whatever that is, or whoever that is, depending on what state or country that you're in, and kind of go through this, the channels of how to do things, you know, legally and all that. But let's say that, you know, you're cleared by that and your doctor, therapist, or whoever is like, you just go home and look some exercises up and start doing them. I mean, honestly, with the way the internet is now, I mean, you can YouTube, you can Google, you can TikTok, Instagram, whatever, all sorts of exercises that you can do. And, you know, that if you just literally type in, you know, rotator cuff torn exercises or rotator recovery exercises or something like that, you know, I'm just I don't really know, I'm just kind of paraphrasing some of this, but you can look that up and you can find a lot of really good stuff. I like to start what's called isometrics, where there's a muscle contraction, but then there's not a lot of movement, or really should be no joint movement, so to speak. I like to use isometrics. It's a good, safe, what's called low threshold strategy. You know, there's not a lot of exertion going on there, and then progress from there to actual movement and you know, more difficult things. Not a fan of just using bands. I know some therapists, you know, they use just bands. I'm not saying they don't have a place. I've got, I don't know how many bands at my clinic. I have so many bands. Like resistive bands, TheraBands, and just different TheraTubings, and you know, all these different things. So I do use them, but that's not the sole thing that we use, because I think you should mix up different things. So dumbbells, kettlebells, your resistance bands, isometric stuff, using medicine balls and things like that. Just a collection of things that you put together. Because just using the band, it's really more like a linear resistance. So like the further that you go with the movement, the more resistance that you have. And so I like to just use a variety of things, honestly. And of course, I'm always trying to find, based off of research, what exercises maximizes the EMG activity. So what, you know, electrical activity in the tissue and the muscles. So, you know, especially when people don't have a lot of time to spend, you don't want to go through 2 hours of exercises, you know, right? So you want to kind of highlight, hit the points that's going to you're going to get the biggest bang for their buck. So that's kind of what I do with that. But like I said, you could look that up and come up with some really good treatment techniques for that. The biggest thing really is to, like, don't get bogged down in one of these things where it's like, these are the only things that you do. Fix your rotator cuff with these 3 moves. You know, I actually did a video about, I think it was 6 rotator cuff exercises. And I picked those 6 just because it was 6 that I really liked. And honestly, I thought they were easy for people to do, and it's something easy to remember. If I found 4 that I really liked, and 4 was an easier number, I'd have picked 4. But just trying to cover a little bit of all the different aspects. I like those 6. And you know, just recommended those. I think something simple is, you know, is best, because a lot of people, you know, want to go home after you've worked all day, and if you've got kids and different things, you don't want to go home and like, okay, now I'm going to go through all 35 exercises for my shoulder alone, right? Like, that's not a good idea either. So you want to just do, kind of get in and get out. Do what you need to do, then get out. So, so that's, like I said, that's my opinion on rotator cuff tears, because I get a lot of questions on that. You don't necessarily have to have surgery. Some people require it. Some people, there's no way around it. That's typically more significant with large tears. So, you know, but with a smaller tear or even a medium-sized tear, you know, a lot of times you can get away with doing, you know, good therapy and and basically returning your function and not having any issues. So anyway, I hope that helps, guys. Thanks so much for listening. I really appreciate all the support, and you guys have an awesome day.